Welcome back and thank you for staying with us on The Conversation. Now, to a bit of health. Mpox is a contagious disease and has been declared a public health emergency. Now, it's spread rapidly in Africa with over 13,700 cases and 450 deaths in the Democratic Republic of Congo. In Nigeria, 39 cases have been reported so far with no deaths. Now, the Nigeria Center for Disease Control is taking measures to prevent the spread, including screening travelers and also considering vaccination for high-risk groups. Now, to speak to us on this, we have two guests. Dr. Chizaram Onyeaghala, infectious diseases physician, University of Port Harcourt Teaching Hospital in Rivers State. And we also have joining us virtually Dr. Philip Njemanze, medical practitioner in Owerri, Imo State. Good evening, gentlemen. Thank you for joining us at this time.
Thank you.
Thank you for having me.
All right, so let me begin with you, Dr. Chizaram. What are the implications of the World Health Organization and also the African Center for Disease Control and Prevention declaring Mpox a public health emergency?
Okay, thank you. Good evening once again, viewers. Like we know, Mpox is a disease of global public health importance. And then in 2022, I wouldn't want to go back to 2017 when we had a resurgence of Mpox. But of recent memories in 2022, when we had a multi-country outbreak, so the World Health Organization declared Mpox a public health emergency of international concern because of the multi-country outbreak, particularly in non-endemic countries. There are endemic countries where you have this disease and there are non-endemic countries. So the public health emergency of international concern then was actually to call for an international global health coordinated response to deal with the outbreak. And that was done in 2022. A bit mid-2023, the PHEIC, was called over. And then the response went back to the way it usually is. And then this year, we've started noticing increased cases of monkeypox in the Democratic Republic of Congo. And then the numbers was increasingly expanding. And then with time, we started noticing that we're having more cases spread outside the Democratic Republic of Congo into Burundi, Kenya, Uganda, and Rwanda. And what is important to state is that most of these countries have not reported a case of Mpox before. So that's part of the reason why the World Health Organization and the African Center for Disease Control decided to declare it both a continental global health security emergency and also public health emergency of international concern for the second time.
All right, now still on that question, and we're moving it to Dr. Njemanze. Now, it's actually quite a scary situation considering that some cases have been reported in Nigeria, but it doesn't seem that a lot of people are taking this, health emergency seriously in Nigeria. So what can you actually say, or how do you respond to this?
Well, the monkeypox in endemic areas does not constitute a major alarm because it's endemic. That means we know that it occurs both in Central Africa and in West Africa. There is nothing very unusual about that because we have had incidents of this in the past. Now,
so you're saying the fact that
non-endemic countries.
So, Doctor, are you saying that the fact that it's just occurring in Africa doesn't make it a pandemic?
No, I was just coming to that. When you now start reporting it in non-endemic countries, that is, there were cases, about 92 cases spread across 8 countries where this disease does not occur. It was mainly found in homosexuals, men having sex with men. Then this raised an alarm, at the level of the WHO, alerting people about something, and that's really very valid. That because this is for the first time being observed in a particular group of people. But since this is endemic in West Africa and Central Africa, it does not constitute a matter of extraordinary urgency. However, it is a welcome development that we have now a surveillance system, and it is very, very welcome that the NCDC is up to the task of monitoring the number of cases being reported from different states. This was not the case 10 years ago, and even much earlier. There was no real surveillance of these cases going on. However, we have to be very careful in raising public emergencies about these conditions that arise from time to time, because these are natural processes, and these are zoonotic diseases. Since they are zoonotic, that means human beings get in contact with animals, either being hunters or being people who go to find these animals and for food. So we should expect such cases to occur. To go into the emergency routine each time that happens really is not very helpful. It only raises panic and creates unnecessary or health anxiety for the people. So as far as the endemic countries are concerned, then I think the hype should not be that much. But the non-endemic countries have reason to really raise an alarm, because that's the usual thing observed in medicine. Once something is occurring where it should not occur, then it raises an alarm.
All right, so just before, we move to Dr. Onyeaghala, and to clarify, so one case has actually been reported in Sweden. So you're saying that, the fact that it's just one case, so it doesn't, so no alarm should still be raised and doesn't really make it a pandemic as well.
No. I think, no, the non-endemic countries, Sweden is non-endemic for
Yeah.
it. Belgium, United States, these are non-endemic places. So it constitutes a matter of health emergency. Yes, it is valid. But in an endemic country like Nigeria, Congo, even to a great extent, the whole countries in Central Africa, it is almost like a thing that occurs from time to time, and this is a zoonotic disease. That means that it's in animals which surround the whole area. So it shouldn't be a matter of raising a hype or a media hype on this that raises the level of anxiety for people. And when you do this, for these diseases, you are now ignoring the real threats we have, the real cases of malaria that will kill more people than even monkeypox will ever do. You're raising alarm, taking away attention from hypertension that could kill far more people than the monkeypox could. So that's why it's not really helpful to have all this media hype on a disease that is endemic in our area.
All right, now let's move to Dr. Onyeaghala. All right, now, do you agree with Dr. Njemanze that, going into emergency mode when such cases actually happen isn't worth it? And also, how worrisome would you say is the rapid spread of Mpox in Africa? And how will it affect global health security?
Okay, thank you again, viewers, and thank you. Good evening for having me. So there is something we should know about emerging and re-emerging infectious disease threats. Mpox is a DNA virus, which usually DNA viruses don't mutate as much as the RNA viruses do. More so, Mpox is a large DNA virus. So when you begin to see increase in cases, even in the endemic countries, increase in cases, such as what we are seeing in the DRC, where it's endemic, you are beginning to see increase in cases. So you begin to get worried. What's happening? Why are we having increase in cases? And that's what genomic sequencing offers. The genomic sequencing infrastructure, more like a test. So it was because of the increase in the cases that we're having in DRC. That's why they did a genomic sequencing. And they found out that that pathogen has now mutated. There's now what they call the clade 1B, which is more transmissible than the previous clade, which is 1A or 1 as it is now. So what is the implication of transmissibility, mutation, change in clades? The challenge is, one, it leads to what? More transmissibility of the virus. Perhaps that's why the virus was able to spread beyond the borders of DRC to Rwanda, to Uganda, to Kenya, and to Burundi. Of course, we know that the South Kivu province, where this disease is increasingly being reported in the DRC, is a border region with other East African countries.
Okay.
What implication does it have? So you need speed. The reason for the PEAIS is to call for a global coordinated response in governance and coordination, in enhanced surveillance and diagnostics, appropriate case management, and then also access and production of medical countermeasures, which include diagnostics. Because when you begin to have mutation, even your previous diagnostic may not even be able to pick the virus. So you need to accelerate, production of medical countermeasures, which include diagnostics, therapeutics, and also the vaccines. So that's what the world is trying to rally around in terms of funding for all of these pillars to address Mpox.
All right, Dr. Njemanze, now that we have 39 reported cases, across 33 states in Nigeria, how would you advise the health sector to buckle their belts?
Well, I think what we normally do with infectious diseases is basically to create awareness that if you should see somebody with these symptoms, fever, rashes, and you should have the idea that maybe this could be Mpox. That index of suspicion is good enough. And one has to make sure that there are leaflets in the transport system. There's awareness in the churches or any public space, so that people will, if somebody is reporting headache, especially children, fever and some rashes, so one can say, well, maybe it's Mpox. That's good enough. What is not helpful is when you use the media and create such a hype that it causes this country to squeal resources. That means if we had $1,000 to spend, we now take that thousands in health, then we now take maybe $500 to pursue monkeypox and it's the whole network and set up a whole network. But while we are doing that fight, this budget is fixed. When you're usually doing that with $500, you have skewed resources for malaria, from typhoid, from cholera, and every other disease that is also even more deadly than the monkeypox. So this is what is not helpful. And this idea of hyping this, diseases is totally unhelpful, and it's actually ill-advised. And because what it creates is a public sensitivity that, oh no, we are going to be killed by monkeypox, so let us go and start pursuing that. And while you're doing that, the real things that are killing the society is still ravaging the place. So that's why we must be very careful on how we hype this whole issue and then putting it as the things we need to do. We know what we need to do about infectious diseases.
All right,
we
talking
know
about
that
things we need to do,
set
Dr.
up the
Njemanze,
network to monitor.
the government actually
the only thing the public
can you hear
needs
me?
is awareness.
Talking about things we need
Yeah.
to do, the government did say that they're expecting to receive 10,000 doses of the vaccine, to boost response. So what do you think would be the likely challenges associated with this vaccine distribution? And also, do you think that with this vaccine that it will help curtail the spread of this particular disease?
Well, you see, the public have been somehow sensitized that vaccines provide a panacea for everything in medicine, particularly all these viruses. That's not true. Vaccines should be used for a target group of high-risk people. For example, if you were to select high-risk people, you will see the conductors and the drivers in public transport face a very much more higher risk than the rest of society, because they are carrying and moving mass number of people. And then you use vaccines in that regard. This issue that, oh no, that you every time you spend resources purchasing large doses of vaccines and as if it's going to solve any problem, like the whole total calamity we had with COVID. So it's going to, it's medically untrue. It doesn't work that way. So you should use vaccine to protect high-risk groups and in a targeted way. Okay. And that's the correct thing to do.
All right.
Rather than just, everything you throw a vaccine to it.
All right. Well, just before we go, in 1 minute, Dr. Onyeaghala, one of the challenges associated with diagnosing Mpox in Nigeria has to be early detection. So how do you think that health workers can improve detection rates?
Okay, so what we need to do as a country is that we need to invest in enhanced surveillance. So there's passive and active surveillance. What the health workers in the hospitals will do is what we call the passive surveillance. The patients come to the hospital and you look at them and you see whether they have Mpox or not. But what that would detect is what I would call a tip of the iceberg. So at the National Technical Working Group, we've discussed this in successive meetings today and yesterday, that we need to go into the communities and do an active search for Mpox. And that requires enhanced surveillance, because most of these cases don't come to the hospitals. They don't feel that they should come to the hospitals, either for reasons of stigmatization or reasons of out-of-pocket payments. So enhanced surveillance, active search of cases in the community by those that we have trained to do that, which are the surveillance notification officers. They live in the communities, they see these cases, they should bring them. But that requires funding. And that's part of the reason why the African Center for Disease Control had earmarked about $10.5 million, because there are 5 pillars that needs to be strengthened to, address Mpox. And also, the WHO has also earmarked $15 million for this. So that's part of what the response is all about.
All right. Well, thank you so much, gentlemen, for taking time out to join us and speak to us, and also to enlighten us on this particular Mpox infection. Dr. Chizaram Onyeaghala, infectious disease physician, University of Port Harcourt Teaching Hospital. And we also have Dr. Philip Njemanze, medical practitioner from Imo State. We appreciate you for your time.
Thank you for having me.